I'd like to show you the proper way to perform a lunge. A lunge is a fantastic exercise, not only as a strengthening tool, but as a dynamic warm-up. Like we've done most exercises, I'd like to show the incorrect way of performing a lunge first that we see regularly. As we've talked about, the position of danger for a young athlete with the potential to tear their ACL is this position here. So we want to avoid that position and teach the body to control that movement. So when we perform a lunge, the same rule is similar to the step down and single leg squat. When they come out, we don't want that knee to collapse in. We don't want their hips to drop out to the side. And we also don't want their trunk to be out of control. Now, if you have issues with trunk control, there's one way around that. Again, you have to have the tool to do it. But if you get a wooden dowel rod from any hardware store, you can have the athlete hold it along their spine to keep their spine straight. It gives them a nice cue to stay straight. But again, to perform a lunge correctly, the hand should be on the hips, the athlete steps out, the kneecap is over the second toe, pelvis is level, and they push back. Once your young athlete has mastered the front lunge, you can really lunge in any direction. We encourage athletes to go in multiple directions because they move in multiple directions. The easiest way to explain these different directions to an athlete is to think of a clock. If I lunge straight ahead, I'm lunging to the 12 o'clock position. We can have our athletes lunge to 10 o'clock. The same rules apply as the front lunges. Or we can have them lunge to 3 or 9 o'clock, depending on which leg they want to work. So as they go over to the side, the hip is over the knee, it's straight, the trunk is upright, and they push back. I'd like to talk next about the squat. The squat is the most basic exercise that really any of us have to do because we do it every day. But it is done incorrectly all the time. And unfortunately, many athletes aren't able to do a correct body weight squat before somebody puts a bar on their back in high school or maybe late in grade school to start weight training. But it is imperative that the athlete learns to squat correctly because again, it gives clues to total body control. So again, let's talk about, like we have with many other exercises, the incorrect way that this is done. Typically, we have an athlete get their feet a little bit more than shoulder width apart. When we ask them to squat, many times they'll come down and we'll see the knees collapse in. And we've talked about how that knee collapsing in is a danger position for the ACL. That's the first part. The second part is that many times we see the athlete loses trunk control and they come forward, so they're not able to go down all the way. Many times it's incorrectly stated to the athlete that because they get here and this is as far as they can go, that their hips are tight. The way to check this though is to have the athlete squat on their own, so they get to this point like this, and then a coach or a parent can step in, hold the athlete's hands, and the athlete would use the parent or coach for support. And then the athlete will squat again, and then you'll see they'll magically have better form and they're able to get lower. What changed is that the athlete got stability from the parent or the coach. This is again a huge red flag to parents and coaches that the basic exercises showed on the mat, the clamshells, the bridges, sideline leg raises, side bridges, planks, need to be done in addition to squats to get the athlete to learn proper body control in the first place. Now, if an athlete cannot get all the way down with proper control, they can use chairs, they can use a bench at the gym, anything to facilitate proper control. I'm going to show this from the side. We don't want the trunk lean forward and the nose over the toes like this. We want them to sit back, the knee stays behind the toes, the trunk is parallel with the shins. Okay? And then they work on coming back up. We want them to keep their eyes forward. If they drop their head, where the head goes, the trunk follows. So we want to make sure that they keep their heads up. Now, to make this exercise more challenging, we like to use bands around the knees. Now, you can order these bands online, really anywhere. But what this does is it helps facilitate use of the hips to control their squat movement. So what I'll do is I'll slide inside of this band here. And the athlete will push out against the band. And as they go down, they keep tension on the band, driving the knees outward, which again simultaneously will work on those very hip muscles we were trying to address at the beginning. The reason is that we want to avoid this knee collapse position. This helps facilitate proper position of the knee. Now, if you found that your young athlete was able to squat lower with your assistance, you can have two teammates help each other, but again, we don't want our athletes to rely completely on their teammate for help. They should use their legs as much as possible. Their teammate is there for support. So one teammate could hold hands, the other athlete would squat. Another way to do this is you can use ropes and either tie them to a wall or tie them to a fence, and an athlete can hold on to them for support while they squat until they get better form and they don't need them anymore. This next exercise is called the step down. Now, step down is not only a great strengthening exercise, but it's also a fantastic screening tool for a coach. If you don't have a step practice, that's just fine. You can have the athlete perform a single leg squat. Let me talk about a couple of the ways that are incorrect, or the ways that we see most often. And this is a great exercise. It's a red flag exercise for parents and coaches to see the at-risk positions that especially young girls can put their knees in certain sports. So, I'll start on the ground with a single leg squat if we don't have a step in practice or anywhere at home that we can use. When we perform a single leg squat, we want the pelvis level, the trunk upright, and we want the kneecap over the second toe. We tell our athletes that think of the lower leg as the train and the kneecap, excuse me, the leg is, let me start over. This next exercise is called a step down, but I'll also show a single leg squat in case you don't have access to a step to perform this. This exercise is not only a fantastic training tool, but it's also a great screening mechanism for coaches and parents to see if their athletes are at risk for injuring their knees, and you'll see why here in a minute. When we perform the single leg squat, we want to make sure that the pelvis is level, the trunk is upright, and that the knee and the hip and the toe are in a straight line as it's performed. We tell our athletes that if you think of the leg as a train track and the kneecap as the train, we want to make sure that the train has a good track. So the proper performance of a single leg step down, or excuse me, a single leg squat, is that the athlete will come down like so and then back up. You'll see my pelvis was level, my trunk was vertical, and my kneecap was aligned over my second toe. Now, the way this is incorrectly performed most of the time in young, particularly young female untrained athletes, there's a few ways they cheat. One is they come down and the knee buckles in, and that is actually the position that athletes tear their ACL in. They drop the pelvis, so you see my hips drop this way, or as they squat down, their trunk wobbles around a little bit. When the trunk wobbles around like that, that indicates poor hip stability issues, which is precisely why those exercises that you saw on the mat earlier will help prevent those positions from happening. If you do have access to a step, and you can use a step in the house, you don't have to have this particular step. Stairs in the house will work just fine. Same rules apply. The athlete stands on the step, and they will lower themselves and tap the heel to the floor and come back up. But we're looking for the same things. We don't want the knee to collapse inward. We don't want the pelvis to drop. And we don't want the trunk to be out of control. Now, let's say that you're on a step and your young athlete has good control at one point, but then they lose it. You would stop the motion at that point, and then as they get more strength and control, you can increase the depth of performance of the exercise.